While we went through medical school, we always felt like the guinea pigs, like, any sort of problem shooting was done through us. I think it helped us become more resilient, and I think we're also the kind of group who, if we fail or if there's a roadblock, we just push ourselves back up and study harder and work harder to get to where we want to go. Medicine's a long journey. It's a hard journey, and 10 years down the track, I'm still studying, I'm still training, so I'm still, I guess you could say, in some ways not there yet, but it's a very, very rewarding and a very enjoyable journey if you let it be. I didn't want to be a doctor when I left school, and I went to uni, did a few other degrees, a few other subjects, and then eventually when I did some science subjects and physiology, I realised how much I loved it, and thought I'd give medicine a go, and I've never looked back since. I absolutely love medicine, and I absolutely love what it has to offer, and I'm glad I did it that way because I know I love it even more. Studying at Western Sydney, it didn't have that big university feel. It was an amazing feeling because we had a cohort of about 100 students who had the opportunity to become really good friends, and 10 years on, we're still all very good friends, and I think that's something I didn't expect but turned out to be a very beautiful thing. There was always someone we could approach and talk to if there was ever something that was bothering us, whether it be within medicine or within our lives. And going back to Blacktown as an intern resident registrar and as an advanced trainee, there's always those mentors that we had in medical school who trained us and supported us, and they always still take the time to stop us in the corridors, have a chat with us, ask us how we're going, not just in medicine but in our lives in general, and they've become, not just long-lasting mentors but friends and colleagues in this journey. Medicine is a very multidisciplinary field, and it's not just dealing with other doctors, but it's dealing with all the allied health staff, the nursing staff, the patients, and all the greater staff that work within the hospital. And I think being at Western Sydney, learning that there are different approaches to not just medicine but life, I think it helps you understand different people, different perspectives, and different aspects to life. Throughout the university degree, we had a mix of lectures and then problem-based learning. So the lectures sort of give you the knowledge, and sometimes when you're on the wards and you come across a disease or you come across a problem, you do remember those things that you learned in a lecture, and it hits that light bulb that you didn't know was there for 8 years because you hadn't thought about it for 8 years. And then the problem-based modules that we used to do probably helped us deal with what we do on a day-to-day basis. So look at a patient, realize that there's a complexity of problems involved, and bring together the mix of medicine, the social aspects, and the anatomical and physiological aspects all together to try and deal with each individual problem that we come across.